This morning we're talking with Dr. Chip Grant from the Cardiology Associates at Spring Hill Medical Center, and we are talking women and heart disease. And what we have here, 1 in 8 women ages 45 to 64 have heart disease, and after the age of 65, the odd increases to 1 in 4. That seems really high.
Yeah, it is, and heart disease continues to be a major problem for women, both in terms of morbidity, which means, you know, things like heart attacks and all the bad stuff that goes along with that, but also in terms of mortality. It's a major killer amongst women.
Okay, now why do the odds increase as you get older?
Well, as we get older, risk factors aggregate, they build up, and so all the things that we know that contribute to heart disease, like high blood pressure, diabetes, build up, and so that increases the risk. But the other thing that happens is that people become more sedentary, and people become more obese because of their sedentary lifestyle, and so we know that really increases the odds of having problems with cardiovascular disease.
Is there anybody who is more at risk?
Well, you know, we've all heard the traditional risk factors. We know that high blood pressure, for example, increases cardiovascular risk. We know that having high cholesterol or certain types of cholesterol increases cardiovascular risk. Diabetics are definitely a group that struggle with cardiovascular disease. People who are obese have increased cardiovascular risk outside of the sedentary lifestyle, and then just not getting enough exercise also puts you at risk. There's also really complicated genetic things that portend bad things from a cardiovascular standpoint, but we're really only now beginning to understand that. So if someone says, you know, my mother or my father has heart disease, what does that mean to me? The answer is it may mean something, but it may not, and we're really in the early stages of understanding that.
So when you go to the doctor, what do you need to tell your doctor? Do you need to say, you know, this is in my family, just need to make your doctor aware? Definitely.
I think that that's part of a comprehensive medical history that any doctor is going to do, especially if they're screening for cardiovascular risk. They're going to want to know about your family history, but again, just because your parents have cardiovascular disease or a brother or sister does not mean you're going to have it.
Okay, now, especially if you do have a family history, what are some things that you can do to decrease your risk of getting cardiovascular disease?
Well, the things that we've just talked about are important to treat. Obviously, hypertensives, people with high blood pressure need to treat that. People with high cholesterol need to treat that. I should have said smoking earlier, because that's a huge risk factor for heart disease, and that's something that obviously we can affect. And then there are other lifestyle things that we can work on, and the biggest one is exercise. It's amazing to me how little exercise we all get as Americans. We're super busy, there's a lot going on, and people just don't seem to have time. And we know that if you look at everything that I just described, high blood pressure, cholesterol, diabetes, and all those things, and you took all of those things away, and then you compared that to taking someone who doesn't exercise and make them exercise, the exercise will have a bigger impact than treating any one of those other risk factors. So really the biggest thing for women and men in this country in terms of reducing their cardiovascular risk is getting up and exercising.
And per week, about how much would you recommend, how much exercise would you recommend getting?
There are a lot of different recommendations that have come out from the American Heart Association, American College of Cardiology. Everybody's got an opinion. I make it simple for my patients. The simple thing is the more exercise, the better. Although it looks like when you get to about 30 minutes a day, the benefits go down some. So I think that the goal should be 30 minutes of exercise 7 days a week, which is a lot. But the other way to look at that is that, you know, you've got 23 and a half hours to do something else if you build that into your schedule.
Okay, so we're in a new year now, so time to start really taking care of yourself and start taking care of your heart. Thank you so much.
Thank you.
If you would like to get more information about Dr. Grant or Cardiology Associates at Spring Hill Medical Center, you'll find that on our website. Just look for Healthy Living under the Studio 10 tab. It's all online at fox10tv.com.